really is an honor to be invited here to speak with you all on this topic that's very near and dear to my heart. The title of my talk is Post-Traumatic Growth in Cancer Survivorship. I'm going to introduce myself a little bit more on this slide. So, growing up, I always knew I wanted to be a doctor. I went to college at Tulane in New Orleans and started my pre-med courses right away. I graduated in 2006 with a bachelor's in science, majoring in neuroscience, and I got a master's in neuroscience. And then I stayed in New Orleans for one more year, worked in labs, researching rare diseases, went back to New Orleans for medical school and finished in 2012. During all that time, I knew I wanted to do women's care and cancer care. And so then I matched at my top program in New York at Cornell. And then I did my 3-year fellowship in GYN oncology at NYU. And so I know it sounds like I'm bragging, but I'm not. So, in addition, I've presented research at conference and notable publications. So I have, a lot of qualifications. Additionally, in my spare time, I read about cancer. It's like my favorite thing to learn and read about. I read these journals. This is in my apartment, stack of journals that I read in all of the free time that I have. However, my real training in cancer and oncology did not start until January of 2021. This is me at an infusion center at NYU where I work as a patient, so on the other side of things. Since then, I've gone through 20 weeks of chemo, 6 weeks of radiation, 3 major operations, weekly visits with a therapist, acupuncture, joy, heartbreak. I'm currently in remission. I'm very grateful for that. I've experienced so much love and support, especially from my family and friends and from my medical team here at NYU. And I've seen all of my knowledge and training be put to use firsthand. I've also grown immensely as a person and a physician during this time, but it was all against my will. There are some gaps in my training that I noted right away, right from the outset. Some things that I never learned about during training, some things that you can't learn until you're going through it yourself, but now I've seen are issues that need to be addressed. And so with that being said, I would like to earnestly and humbly share my opinions and thoughts on some issues that affect cancer survivors. I will discuss scientific data to support everything that I discussed today, but it will all be through my own personal lens. So today's objectives will be to discuss the phases of survivorship, to understand cancer as a type of trauma, to outline ways to help get through this inevitability, to define post-traumatic growth, and to explore ways to enhance post-traumatic growth. And so, estimated 18 million people in the United States are cancer survivors today. This is why I believe this is such an important topic. This issue is only going to become worse. These numbers come from the American Cancer Society, facts and figures 2022 to 2024. But what we have more people who are living longer, so more people who are alive with a history of cancer. Then we have better technology, better science, better treatments that are allowing people to survive their cancer. In addition, we have continuously increasing rates of cancer for certain cancers. And so, and with that being said, 18 million people right now are alive with cancer, or alive who had cancer or have cancer currently, and it's going to get worse. I know the term survivor doesn't resonate with all people who have had cancer or have gone through treatments, but I will use the term because it's generally accepted by major academic societies in our country. These are the definitions of from the American Society of Clinical Oncology on their definitions of survivorship. So acute survivorship starts at the time of diagnosis. So the day you're diagnosed and through active treatment is acute survivorship. Extended survivorship is the months right after treatment's completed, and permanent survivorship is the passage of time after treatment, often measured in years. We also know that survivorship, not everyone can fit into one of these nice little boxes. There's people who remain on medication for years, people thrivers, people who have recurrences and whatnot. So these terms don't really encompass all of the people with cancer. So this is my version of acute survivorship. So getting through active treatment to me felt like treading water. I was using all of my energy to try and stay alive, try and make it to the next phase. In active treatment, society is going to help you out. I had friends and family checking in on me daily. I was lucky and my job was very understanding and gave me time off to recover from my treatments. This in turn gave me time for rest, to take daily naps, and I had plenty of time for self-care. I spent a lot of time seeking out different management options for side effects that I was experiencing. I had time to go get massages and try acupuncture and meditation, all the other things that I had tried during that time. I was very lucky and very privileged in that regard. Another thing that we don't really talk about that often is that during this time, I looked sick. I lost my hair. I was pale from anemia from the cancer treatments. And I looked exactly how society depicts a sick person or a cancer patient. And with that came society's willingness to accept that I probably couldn't do all the things that I had once felt well enough to do. Another thing, which I also think is overlooked, is the comfort of seeing or speaking with your doctor weekly or biweekly during active treatment. Someone tells you you're okay all the time during a really hard and anxiety-provoking period. And then active treatment ends. And you're getting tired of treading water. Your support system slowly fades away. Friends and family assume that you should be feeling better. You see your doctors much less. All of a sudden, your doctor hands you a packet of paper with signs to look out for when you experience a recurrence and says, see you back in 3 months. But just weeks ago, you were so sick that and receiving such toxic medications that you were needing to be seen multiple times a month, even weekly. Your hair grows back so you don't look sick, and all of a sudden, everyone expects you to go back to normal. This is a poem that I've loved ever since I saw it. I find it really powerful, and I think it really captures the essence of what I'm trying to convey in this short talk. The poem reads, I never wanted the lifetime membership to survivorship, yet here I am, struggling to stay afloat on this effing life raft while the others wave from their cruise ships and say, I thought you were fine now. So what happens now? What are we supposed to do when you're alone on this life raft and your support fades away? What do we do when we're supposed to be fine and we're not? Well, that's the million-dollar question. Well, why does any of this matter? Well, I don't know if you know, but May is Mental Health Awareness Month. And even before having cancer, I've been a big advocate and supporter of destigmatizing mental health issues and bringing them to light. But alas, still, it remains a soft science. But besides caring about mental health, are there any other reasons why the medical community and society should care about what we're discussing today? I obviously feel very strongly that the answer is yes. This is a quote that kind of shook me the first time I heard it. You're not healing to handle the trauma. You already know how to do that. You're healing to handle the joy. And I think this really kind of hits a nail on the head, why we have to do this work, why we have to talk about these things. I could talk about this for days on end, but to get people to listen and to really care and to get society to listen, we have to talk about the science behind it. And so I'm briefly going to be talking about that. So scientific research has shown that stress-related psychological factors influence the development and progression of cancer. Stress influences cancer cells growing. Stress can affect your immune system and thereby affect several downstream processes that your body needs to fight and repress cancer cells. Also, the duration of stress matters. So prolonged exposure to stress can set off chain reactions that you kind of awaken dormant cancer cells or cancer cells that have kind of been suppressed from treatment. In animals, studies have shown that stress hormones can cause immune cells to produce proteins that awaken cancer cells. And so this is why it matters. So what happens when you first get a diagnosis of cancer is you're routinely screened by your provider for depression and anxiety. This should then automatically trigger some sort of evaluation by a social worker who's involved in your cancer care team. Sometimes this happens by phone or in person, and then a more comprehensive screening will happen. The reason this all happens is because depression and anxiety are known to be very prevalent in people with cancer. Depression and anxiety affect up to 20 and 10% of people with cancer, respectively. This is in comparison to 5 and 7% in the general non-cancer population. So tons of research has been done on this. And it's not just a mental health issue. It's not just that you're sad because your life just got flipped upside down. There are true biological components to this anxiety and depression as well. We know that certain cancers release chemicals into your body that can cause depression or mimic the symptoms of depression. We also know that certain drugs or treatments that people are getting for cancer are associated with depression. One of the main ones that comes to mind is steroids. So oral or IV steroids, which you get routinely with certain chemotherapies, can cause symptoms of depression. But these mental health issues don't go away once the cancer is gone. In my opinion, this is the elephant in the room. It's well regarded that having cancer is traumatic, but why does the medical community and society so infrequently regard it as such? This quote is from the book, The Body Keeps a Score, which discusses healing from trauma. The author discusses that after trauma, the world is experienced with a different nervous system. The survivor's energy now becomes focused on suppressing inner chaos at the expense of spontaneous involvement in their life. I can bet that most survivors tuned in tonight can identify with this. But if cancer is and cancer treatment is such a traumatic event, shouldn't we also discuss PTSD or post-traumatic stress disorder? But literal research has been done in this arena. So before we talk about that, let's define trauma. The DSM-5 is kind of the Bible of psychiatric and mental disorders. It defines trauma as an event that imposes actual or threatened death, serious injury, or violence. So by definition, it's a bad experience. It's a negative experience. And according to the DSM, cancer would be included as a trauma. It's a seismic event that shakes your world and can shake your worldview. The other thing that trauma is known to be is it's a uniquely subjective experience. An event that's considered traumatic to one person may not be traumatic to another person. For instance, I have a patient that I'm treating who is approximately the same age that I was when I was diagnosed with cancer. And she just received a diagnosis. And I keep asking her, are you okay? Because in her shoes, when I was in her shoes, I was not okay. And she's like, yeah, I'm fine. And I keep asking her and she's like, I'm fine, I promise. And I think it's just because, it really shows that this is a truly subjective experience. And so another thing that about trauma is that it is unexpected, uncontrollable, yet inevitably a part of life. In 1994, cancer was added to the DSM as a stressor capable of causing PTSD. This was important because it helped gain attention and foster research for the cause. Also, it was increased societal validation on the subject. But it's also been suggested that the experience of post-traumatic stress following cancer may be distinct from other types of trauma. In contrast to many other traumatic events, cancer is future-oriented with an internal source that it's hard to avoid like symptoms related to the trauma. The patient has to continue going to hospital visits and follow-up tests. A further challenge is delineating the onset and termination of the traumatic event. The trauma can comprise all aspects of diagnosis and treatment, as well as the ongoing threat of possible recurrence. And it's these differences that indicate value in considering the post-traumatic reactions of cancer patients separately from other types of trauma. But again, if cancer diagnosis is traumatic, shouldn't there be more research on PTSD? So just to define PTSD in the cancer survivor, this is from the National Cancer Institute's website. It is an anxiety disorder that develops in reaction to physical injury or severe mental or emotional distress, such as life-threatening events. Symptoms interfere with day-to-day living and include reliving the event in nightmares or flashbacks, avoiding people, places, and things connected to the event, feeling alone and losing interest in daily activities, and having trouble concentrating and sleeping. The severe mental and emotional distress is the immense financial burden and debt that comes with cancer treatment in our country, the threat of dying, which continues long after treatment, the loss of one's job after not being able to keep up at work, the loss of a partner, family member, or friends because they did not want to deal with you and your cancer diagnosis, the loss of your hair or your sex drive or your physical attributes, which help define your sense of identity, and the list can go on and on. I have to be honest, this whole idea of reliving the event made putting together this talk really difficult for me. It's hard for me to sit down and relive these experiences and put it to paper, but it's very important. So I'm glad that I did. So I was able to find 2 studies which focus on PTSD in the post-treatment setting. There was one study which included almost 440 patients with cancer, and what they found is that in that study, about 20% or a fifth of the patients had PTSD at their 6-month follow-up visit. Approximately 1/3 of those patients who were initially diagnosed with full PTSD at 6 months went on to develop chronic PTSD at their 4-year follow-up. In another study of almost 600 participants who were diagnosed with PTSD, more than 1/3 of those reported persistent or worsening symptoms over 5 years. So these are issues that may be affecting our population for a significant amount of time. And so it's definitely something to talk about. It's been more than 40 years since the term ambiguous loss was coined, but this is a concept that is relatively new to me, and I wanted to share it. Ambiguous loss refers to the loss that occurs without closure or clear understanding. It is grief over a loss of what was, but also grief over the loss of what was meant to be, what the future now holds now that it's become unrecognizable. It's the kind of loss that leaves people searching for answers, which complicates and delays the process of grieving. And this can result in unresolved grief. The issue is complex with cancer survivors. The loss isn't always tangible or visible. Most would say, well, I'm sure you've heard this before, you're still alive. And yes, that is true, but it's painfully simplistic. There are generally 2 types of ambiguous loss. The second one is the one I want to focus on. It refers to a psychological loss, including a mental or emotional disappearance, like when somebody's personality has changed so much that they no longer seem like the person you once knew. This is considered psychological absence with physical presence. You or your loved one is physically present, but changed, whether emotionally or cognitively or both. Examples of this would be change caused by a cancer or another life-altering event that is traumatic. Many of you may be familiar with the Kubler-Ross stages of grief. People who are grieving a loss go in and out of these stages in no particular order, but when you've experienced an ambiguous loss, you may become stuck in any one stage. This is sometimes referred to as frozen grief or grief limbo. It can feel like ongoing trauma because there is no answer. And if you're experiencing psychological ambiguous loss, then other people may not even realize that you're grieving at all. Ambiguous losses can feel isolating because they can be ignored, which makes it difficult for the person experiencing the loss. Cancer, as well as other chronic illnesses, put people in situations that seem to devalue their sense of self and keep them uncertain and struggling to understand their losses. So what is the solution? How can society and the medical community change this? We need survivorship programs that provide routine screening for PTSD, even during long-term follow-up. We need to recognize that this is a pervasive issue for survivors and their caregivers, and medical providers need to be aware so that we can try to do everything we can to decrease the financial and emotional burden during treatment and hopefully diminish this afterwards. We need to talk about this more and increase discussion around this topic so that we can decrease the stigma around mental health issues and needs of cancer survivors. There are long-term side effects of treatment, which will have long-term implications on mental health. I read many studies of the feeling of hopelessness with cancer, and most of these studies are performed during treatment. I've spoken with many people in cancer support groups who echo my call for resources after the active treatment phase. We need focused resources during all phases of survivorship. Cancer is a traumatic event, and we need to focus on supporting our patients and friends and loved ones through all this time. And this is kind of a segue into everything else that we will be talking about. How do we learn to cope? One measure of good mental health is the capacity to hold multiple truths simultaneously. For example, one can understand that opting for a hysterectomy is the wise choice, but they can also still grieve the loss of their womb. Feeling does not cancel out the other. This applies to much about living with cancer, both during the months of treatment and in the later months and years of survivorship. We see this to be true. One can feel reassured that they've had excellent treatment and are likely to stay well, but understand that this is never a promise. We are forced to live with ambiguity. Some evidence-based interventions for dealing with this ambiguity include meaning-centered therapy, finding religion or spirituality. Other methods include attempts at reconstructing identity, being open to change. Do not isolate or disconnect, even though sometimes that's all you want to do. Essentially, all of this is to help stop looking for closure and stop longing for a life that used to live. So psychiatrists have sometimes referred to the traumatic experience as a window of opportunity. This may be triggering for some people to hear, and it may sound trite. And this is how I felt about it when I first heard it too, but bear with me. When an individual encounters adversity, whether it's accidental or malicious, sudden or lingering, there are at least 4 potential outcomes that psychologists have proposed. One possibility is that there's a downward slide in which the initial detrimental effect is compounded and the person eventually succumbs and is defeated and does not ever recover. A second possibility is that the individual survives but is diminished or impaired permanently. Where I want to shift gears towards next is the other potential outcomes. A third outcome is that the individual returns to their pre-adversity level of functioning, so they quote unquote recover. And the fourth possibility is that the person may surpass their previous level of functioning, and this is what we call thriving. The thriving outcome has been studied extensively and is generally called post-traumatic growth, and we'll go into depth about this today. There's been very little research into this in the cancer population, but we'll talk about it. So I briefly want to define resilience. Resilience is an important topic that has been studied extensively. It can be viewed as an individual's ability to maintain or restore relatively stable psychological and physical functioning when confronted with stressful life events and adversity. In the context of cancer, resilience refers to an individual's protective attributes and personal characteristics, which are thought to be modifiable and to promote successful adaptation to cancer. It's a dynamic mechanism that changes over time and can be affected by life circumstances, one's environments, or other situational factors. So aversive or stressful experiences may cause transient disturbances in even the most resilient individuals, which can manifest as mind wandering, preoccupation, restless sleep. And while there's marked variation in how individuals cope with the disease, there is growing recognition that resilience to life-threatening situations is far more common than we once believed. Many survivors can handle extremely stressful experience with minimal to no effect on their daily functioning, and even may experience positive growth afterwards. In addition to biological factors, individuals' personal factors and environmental factors may also play a role, particularly social support. So bringing back to this graphic, this is an analogy I heard really recently. So pretend that you are a building and the trauma is an earthquake. And so on this graphic, the earthquake happens and the part of the building collapses, and some people may choose to live in the broken building, live under some rubble, and that could be survival with impairment. Some people may see their broken building, their broken house, and choose to repair it exactly how it was previously, and that is resilience, that is recovery. Then there's a fourth option here, which is some people may see the broken house, broken building, and say, do I have an opportunity to rebuild and something that might be surpass what it previously was? So the concept of thriving is mainly used to describe those who are one way better off than prior to the trauma. Post-traumatic growth is a concept or term that was coined in the 1990s, but has gained a lot of traction over the past few years. I first learned about it in attending a survivorship lecture through NYU, and kind of it really sparked something in me that kind of forced me to read about it and then talk to other people about it. It's defined as a positive change experience as a result of the struggle with a major life crisis or traumatic event. It is not uncommon, but is certainly not universal. In fact, most people who have a trauma don't have any positive growth afterwards. But knowing that it's a possibility and kind of helping people to think about it that way may kind of promote it in certain contexts. So post-traumatic growth is obviously difficult to quantify and it's difficult to study. And I'm not saying any of this, I don't want to make anyone feel like they should be feeling this way. You certainly do not need to. And this is kind of what this slide is about. So the plaque here is real. It's from a survivor's garden at a hospital in Chicago. It's the perfect encapsulation of what we call toxic positivity. So I actually can't imagine that this was approved to be put in this garden. So the plaque says, make up your mind that when your cancer is gone, you are through with it. Which, as both a cancer survivor and oncologist, I know that's a ridiculous statement. And so toxic positivity is this. It's the concept that refers to the implicit or explicit pressure to stay positive in the face of profound adversity. Toxic positivity can be self-imposed or caused by external pressures like a friend, family member, healthcare professionals, or these plaques in gardens. The reason it is toxic is because it leaves little room for the perceived negative thoughts or negative feelings that are natural to going through trauma or cancer treatment. A big concern with this belief system is that it denies human emotion. It can also lead to isolation if you're not feeling supported and validated when sharing any negative emotion. Toxic positivity is also harmful because expressing your negative thoughts is not only good self-care, it's actually crucial for your mental health. There was a Stanford study that was done over 10 years that found that denying negative feelings as a coping mechanism was linked to higher levels of depression. And another study found in that people actually felt sadder when others expected them not to feel any negative emotions, such as sadness. So there are generally 5 accepted domains of post-traumatic growth. The first one is personal strength, which is characterized by increased resilience, self-reliance, confidence, and increased authenticity. Another is an appreciation for life, which can manifest as increased gratitude, altruism, and a clear sense of priorities. Spiritual growth is the next domain, which is when one develops deeper beliefs and awareness and a clear sense of purpose. This by no means means I'm not saying that it has to be religious, but it can be just a general spirituality. The fourth domain is improved relationships or an increased sense of belonging, increased vulnerability, and increased empathy. And the fifth domain is new possibilities or new interests and perspectives. This is adaptability and openness to new ways of living and working. There are 2 traits that appear to make someone more likely to experience post-traumatic growth. One is openness to experience, and the other is extroversion. I am not an extrovert, and so there's ways to work around that. That's believed to be an issue because people who are more open are likely to reconsider their belief systems, and extroverts are more likely to be active in response to trauma and seek out connections with other people. This is where support groups and cancer friends come into play. Gender and age may also be factors. So some studies have shown a small but increased effect that women tend to experience more post-traumatic growth, but it's a very small effect. And also younger patients have been seen to have more likely to develop post-traumatic growth. So can we set ourselves up for post-traumatic growth? Yes, we can. Traumatic events are insufficient to cause post-traumatic growth. You need to have the ability and desire to sit and heal, to sit alone with your experiences and to reflect on it and to seek to find meaning in them. And as support systems now, I'm sure we have friends and loved ones who have had cancer or going through this. Don't jump right into telling people about post-traumatic growth. Again, that could be seen as toxic positivity, and you don't want to be construed as minimizing someone's pain or suffering. You also you want to be careful to not bring it up until a person's kind of broaches the subject, and you want to wait for them to express some positive reaction. So again, let's briefly talk about the science. Let's talk about what we can be doing to enhance post-traumatic growth. The purpose of this study was to investigate which coping strategies were associated with post-traumatic growth and well-being. This study included 80 women with breast cancer who are undergoing their primary treatment. The investigators of the study used 3 questionnaires to obtain information on the patients. One is the proactive coping inventory, which assesses different coping strategies, and the other is another is a general health questionnaire, which assesses general symptoms. So some of the questions on it are, it's kind of rating yourself. I am a take charge person. You put it as a yes or no. Another one is when I apply for a position, I imagine myself filling it. So just kind of how you rate yourself. And then on the general health questionnaire is been having hot and cold spells, yes or no, feeling constantly under strain. So these things all come together to give you a score. So the results of this study showed that proactive coping, as well as other coping mechanisms, emotional support seeking, and even avoidance coping, were positively correlated with post-traumatic growth. Proactive coping means dealing with a stressor before it's actually happened. So if you talk, this is where, again, cancer friends and support groups come into play. If you listen, to your healthcare team is telling you symptoms that could come up, and then you talk to people who've had this, whatever disease you have, and they tell you what to expect, that can actually increase your ability to have post-traumatic growth. So in contrast, conventional coping is dealing with it when it already comes up. But proactive coping is directed towards the future and includes efforts to promote challenges and personal growth. There was also noted to be a negative linear relationship between post-traumatic growth and impaired social activity and depressive tendency. I want to highlight this finding from the study, which is avoidance coping, which involves doing nothing essentially. This was shown to be a factor affecting post-traumatic growth. Avoidance is usually thought of in a negative light. However, in this one study, they found that avoidance coping was correlated positively with post-traumatic growth. There are reports that avoidance coping reduces stress and can be adaptive depending on how it's used. Immediately after the traumatic event, there's this process of automatic intrusive thinking and rumination. People may lean towards it. In previous studies, avoidance coping has been reported to have aspects of minimizing psychological stress responses through mood relief. So in light of these findings, it's necessary to reassure ourselves and our friends and our loved ones that avoidance may be beneficial. So all the mindless scrolling, watching reality TV, anything that kind of helps you not think about the stress is actually beneficial. However, at some point, to in certain studies have showed that you have to sit and reflect on it, but avoidance is good. Definitely in certain situations. So the title of this slide may seem a little paradoxical. Can increased stress lead to post-traumatic growth? The answer is both yes and no. So there's one survey study that I read in preparation for this. They assessed people with cancer at 5 different time points. First at the time of diagnosis, then at 3 and 6 months after, then during survivorship at 12 and 18 months. The study was investigating both the impact of distress and stress at diagnosis and see if it predicted post-traumatic growth 6 months later. So what they found in the study was that global stress, so stress in general, was correlated with lower post-traumatic growth. However, cancer-related distress increased your likelihood to have post-traumatic growth. And so the authors concluded that greater cancer-specific distress focused the patient's energy on a search for meaning and search for growth opportunities. Whereas general background stress kind of took away from that, detracted from the person with cancer's ability to kind of reinvent themselves and their meaning. The study also showed that 6 months after cancer treatment is kind of the pivotal time for post-traumatic growth. And so this is usually the time where your treatment's first ending. The initial stressor is kind of, you're starting to see an end in sight, or this current treatment is ending. And so this is an opportunity for us as friends and healthcare providers to kind of chime in. So all of this gives us information on post-traumatic growth, but it doesn't feel like we have much in our ability to change. Obviously, this topic is a passion of mine. I could talk about it for days. But the reason we're discussing it today is because we want to elucidate some actionable factors, things we can do. So in one study of almost 2,000 patients that responded to questionnaires, they responded at 2 and 5 years after the diagnosis. Factors that were found to be associated with moderate or high post-traumatic growth were: 1, being satisfied with the time spent by their healthcare team on the information, and 2, increased activity and healthier diet since diagnosis. Another one was having benefited from psychological support at diagnosis. In terms of modifiable risk factors, all of these kind of fall into that category. Physical activity and healthy diet are part of the foundation for improved health and wellness, especially for cancer survivors. And that this should suggest that after cancer, advice regarding lifestyle habits definitely has its place, particularly in the need for individuals to optimize their diet. Another topic that's modifiable, doesn't seem like it's modifiable, is satisfaction with time spent by your healthcare team answering questions. This was associated with higher post-traumatic growth. So they've shown that patients and people who are satisfied with the information they've gotten from their healthcare team have a better quality of life, have less anxiety and less depression. So it seems as though information plays a very pivotal role in regaining control in the face of something seemingly uncontrollable. Becoming confident in your own decisions, understanding the impact of the disease on your life, and overcoming fears and so on. This is where choosing a doctor who you trust and feel comfortable with is key. This is always why I tell people to go for a second opinion if they don't feel comfortable with the first doctor they see. You need to feel safe with your doctor and really trust that they're giving you all of the information. A common misconception is that the post-traumatic stress disorder and post-traumatic growth are on opposite ends of a spectrum. And this is in an old graphic that I'm putting here. But that is not the case. There are studies that have shown that growth is an adaptation in those who experience stress following cancer diagnosis. This may suggest that stress initially increases your ability to post-traumatic growth, but also may hinder it if it becomes too severe. So you want some stress, you need something to kind of give you a reckoning, something to really give you the fear that, counts as trauma, but not too much, so that you can have some post-traumatic growth. So this leads us to conclude that post-traumatic stress and post-traumatic growth are not opposite ends of a spectrum, but parts of a complex web. So this data on this slide is from a study that aimed to develop a post-traumatic growth program. There were 72 participants enrolled. Half were in the post-traumatic growth program and half just went about their day the way their oncologist normally would. The half of the patients who were in the experimental group with the intervention that the program was looking at, they had a program of doing writing and self-reflection for self-analysis, talking and sharing for self-disclosure, and participation in self-help and healing groups for social support. The program is here on the left. So in week 1, there was meditation sessions that were taught. There was a whole counseling questionnaire that was filled out, and you got to introduce yourself to everyone in the group. At sessions 2 and 5, you did a writing exercise and you got to talk about it in the group. And at session 6, it was like kind of a summary and you went over the results. So what they found in this study is that the group that did that experimental intervention with the talking and meditating and whatnot had lower emotional distress scores, lower intrusive rumination, and higher deliberate rumination, meaning time to deliberately sit and think about what they were going through, but it was kind of in their control. So this kind of gives us proof of concept that post-traumatic growth programs have an ability to contribute to the promotion of post-traumatic growth in people with cancer. This was also a very interesting discovery when I was delving into this. We all know that the internet is a scary place. There have been shown to be studies in which post-traumatic stress symptoms are positively correlated with the amount of time spent looking online for cancer-related medical information. So they believe that post-traumatic stress symptoms are linked to the perception of being inadequately informed about their illness, which we kind of referred to a few slides ago. However, post-traumatic growth is positively correlated if your search is predominantly on psychosocial information rather than medical information. So one way that we can seek to improve is by having your medical team fill in the medical gap, and then gives you more time to kind of delve into the psychosocial information on the internet. So the internet has its place in cancer care for sure. But this definitely was enlightening for me. So the conclusions of this study of this talk is that cancer is a complex form of trauma. There are many interventions that may help us grow. It is necessary to develop programs that increase post-traumatic growth and deal with PTSD as well. This is one quote. I added a lot of quotes in this talk. I love quotes that kind of resonate. So the focus is not to advocate suffering as a situation worth striving for, but rather to examine the phenomenon in which suffering and grief can coexist with enlightenment and growth. And this is from a book I read recently. Would I have done anything in my power to go back in time and not had cancer? Yes. But I can also acknowledge that I've fundamentally changed completely. And so this quote also resonated with me. So thank you for your attention. I will take questions now, and I will leave on one more quote, which I kind of is the crux of why I'm so grateful to NYU for giving me the opportunity to speak on this topic, because feeling psychologically safe in terms of mental health is fundamental to our well-being. This is a great question. I spend a lot of time talking about this on a day-to-day basis with my patients, and I think about this all the time. I think getting through, I know I referred to this earlier, the getting through the actual cancer part felt like the easy part. The living with the fear of recurrence that is now from the day I finished treatment until forever, hopefully until I'm a very, very, very old age. That is something that definitely, it takes a lot of active work to feel okay with. And kind of what I tell myself when I tell my patients is the cancer may recur, but you've now handled something that you never thought you can handle. And if it comes back, you'll handle it again. And I don't know if that's, reassuring for people to hear, but I truly, in my soul, you just have to find a way to find something you connect with, find meditation or exercise or yoga or acupuncture or socialization, find something that makes you feel grounded and present and try to stay in the present. And that is definitely harder than I'm making it sound. And it's a daily kind of intentional work of mine every single day. So I feel lucky that I was in therapy before cancer. And so I had a good relationship with a therapist who does not specialize in cancer. So during cancer treatment, I thought I should find a special cancer therapist, who I did. So I've had 2 therapists during cancer, and I did not connect with my cancer therapist. I don't think she understood kind of me and what I was feeling. And while I think maybe some people might benefit from someone who's directly trained in dealing with cancer, I don't think it's necessary. I think the most important thing is that you find someone you trust and connect with and who really understands you. And just like keep at it. Do not stop until you feel peace. And that's what I tell all my patients. Talking about it, doing these kind of things, really forcing myself to do what, we call this like intentional rumination, sitting down, reflecting on my journey, my experience, talking about it to other healthcare providers, it's human nature to try and find meaning in a terrible thing. It's you have to make sense of what you just went through in some way. And so I feel lucky that as an oncologist, I had a very direct way to make meaning, but we all can find a way to make meaning. And even if that meaning is just helping one other person who has a similar disease, like feeling grateful that you have a perspective to share with them. Gratitude, I think, is one of the biggest things that help me cope with stressful situations. I just feel immensely grateful for my support system, for NYU, who supported me through this. All my doctors are NYU. I feel so grateful, so much gratitude. During some things, I actually found meditation was very helpful. I've talked about this in a different talk, but and I'm not really going to get into it too much, but psychedelics have been shown to help with this arena, but we can save that for another talk. You're speaking my language now. I am open to experiences, but again, an introvert. Again, you being here, you doing this is the work. This is you thinking about this topic, you understanding that this is a possibility for you and your support system, reading about it, seeking about it. I actually found a lot of support in Instagram, like cancer accounts, Instagram meme accounts. The Cancer Patient is one of them. No Grief Tourist is another one that I found a lot of kind of validated. It was people who understood my experience, who I didn't have to explain it to, who I didn't have to like prove, like, look, I'm suffering, I'm hurting, people who just understood that. And it kind of, seeing people going through their journey at different stages gave me kind of opened my eyes to what could be. Again, being really intentional about wanting to grow. I think that's it. I think if you want it, you've already achieved a part of it, as trite as that sounds. So I think, just keep doing what you're doing, find your people, find your support group, find whatever it is that you connect to and just like stay with it, stick with it.